So the first thing I want to do is I want to connect some dots because I'm going to be covering some things that you might say, okay, what does this have to do with the topic? And one is looking at wellness initiatives. Organizations have been focused on wellness initiatives, wellness program for many years now. Diversity, equity, and inclusion is starting to get a lot more attention. And diversity, equity, and inclusion initiatives, a lot of them have been focusing primarily on recruitment. But retention requires inclusion and meeting the needs of a workforce. So if those efforts are successful, the DEI efforts, you're going to get a more diverse workforce. And new demographics requires new offerings. So the question I'm asked, I do consulting work and I'm frequently asked the question around, is diversity, equity, and inclusion here to stay? I'm not going to answer that question right away. I'm going to come back to that because the first thing I want to do is I want to frame this discussion for you. And I'm going to start by bringing you into perhaps a world that you don't typically belong to or are a part of, and that is the African American community. So I want to define a term for you, and that term is woke. And the reason why I'm defining this term is because I'm going to be using it. And I don't want you, while I'm using this term, to be in the chat saying, what does that mean? So I'm going to define woke for you. A person is consciously awake. It's of African American origin and refers to perceived awareness of issues concerning social and racial injustice. I hope everybody's with me so far. As a part of framing this discussion is to ask the question, how did we even get here? Why are we all of a sudden in all of these discussions around inclusion? So let's look at some of the things that have happened over the last 4 years. 2016, we had the massacre at Pulse Gay Nightclub in Orlando. 50 people died and 53 were injured. And America got woke to LGBTQ plus intolerance. 2017, we had what was referred to as the Muslim ban. And people came out in protest. Lawyers showed up at the airports to represent. Complete outrage. 2018, the Tree of Life Synagogue mass shooting. In that shooting, 11 died and 6 were injured. And America got woke to religious intolerance. 2017, we had the Me Too movement. In 2018 was Time's Up. And America got woke to gender inequities and sexual harassment. 2018, Nike took the bold step to challenge issues around race, patriotism, sports, and business when it used Colin Kaepernick in its Nike ad. And what Nike experienced was 163 million in earned media. That means They got a value of 160 million in media that they didn't pay for because people were talking about them. 6 billion brand value increase and 31% boost in sales. And America got woke to the buying power of communities of color. 2018, we had the most diverse Congress elected. We saw a lot of women who made it to Congress, and that was due through a lot of organizing of women. And in 2020, we experienced the same thing, women being organized. And America got woke to the power of women. And also, I want to add in 2020, we also saw the power of communities of color. When we saw those communities shift red states to blue states. 2020 was George Floyd, and we all watched on television a very slow death of an unarmed African-American man. We watched 8 minutes and 46 seconds. And protests were sparked, not just in America, but around the globe. The world was watching America. And America got woke to systematic racism and injustice. Then we had 2020, where we've all been experiencing the impact of COVID-19. But all the headlines hit about communities of color that were being hit hard financially by COVID-19, where they were being hit harder with illnesses. Communities of color were being infected in greater numbers, were getting sicker, and were dying in greater numbers. And what this did was this woke up America to health inequities, health disparities, and access to care issues. So businesses took notice. Universities took notice. Government entities took notice. They took notice to social injustices that had not been recognized before. They took notice to health inequities and health disparities. They took notice to buying power. They took notice to voting power. Corporations, higher ed, and government got woke to diversity, equity, and inclusion. Now, I went through this historical data over the last 4 years in order to frame this discussion and to be able to answer the question, is diversity, equity, and inclusion here to stay? I don't know whether or not it's here to stay, but what I do know is that it is definitely here today. And I think it will be around for a while. It may go by a different name, but the recognition that organizations, higher ed, government has to be more responsive to diverse populations, really think about equity and really think about inclusion. I think that is here to stay. And the reason why I believe that it will be here for a while is because this is not something that was legislated in. Diversity, equity, and inclusion, the attention that it's seeing now it didn't come in through legislation. It came in through demand. whether that was by popular demand, whether it was by demand in terms of the protest, or whether or not it was demand and supply. It came in through by demand, which makes a difference. And the reason why where I'm telling you this part and talking about this is because this is going to impact the work that's being done with wellness programs. I was on a webinar yesterday, and one of the webinar was given by the conference board, and the subject of the webinar was the role of boards in human capital. And they spent probably 50% of the time talking about issues of diversity, equity, and inclusion. That was not the title of the webinar. And one of the speakers pointed out that there's one of her clients was actually tying the bonuses of the executives to whether or not they were meeting their DEI goals. And they weren't, and they made an impact by actually showing them how much money they lost, as much as a third of their bonus, saying you would have received this money had you achieved your DEI goals. So what did that executive do? The executive went to its team and said, I don't intend to lose my bonus again. We need to reach these goals. And that will also trickle down to the wellness initiatives. So I don't know whether or not DEI is here to stay in this name, but I do think that it will be around for quite some time. And we need to be responsive to it as wellness professionals. Because if all of these DEI efforts are successful, what are we going to get? We're going to get a more diverse workforce. And if you get a more diverse workforce, remember I said in the earlier slide, once you get this diverse workforce, you're going to have to be able to serve the needs of that diverse workforce. And when we think about inclusion goes beyond hiring. That really does go to how are you going to retain? How are you going to serve? I have a background in healthcare, and I worked for an organization, and the New York Health Plan, we had what was called ethnic marketing teams, and they marketed Medicare and Medicaid products. So what they did was they put together teams, and those teams went into the community. So we had a Russian team, we had a Chinese team, we had a Haitian team, we had Latino teams. And so we had these different teams, and those teams, their goal was to be able to go out into the community and sign people up for healthcare with that health plan. And the question that I asked was, once you get them, are you going to be able to serve them? You're going to expand the diversity of your members through great marketing activity. But once you get them, when they call to the call center, will they be able to be served in a culturally competent fashion? And also just thinking about this issue when you start talking about how you're going to serve these diverse populations. Diversity goes beyond race and ethnicity and gender. These are the things that you usually see. Race, ethnicity, and gender is usually included. What's frequently included is age, disability, nationality, religion, and sexual orientation. And if you can put in the chat, just maybe if these are some of the things that you cover, if there's one of these that you do not address when you start thinking about the issues of diversity and inclusion. And I am trying to see how to show my chat. Okay. All right. These are the things that are frequently missed. When we talk about diversity in our Multicultural Competency certificate program that is offered by the National Wellness Institute and HR.com, one of the things that we focus on is widening the lens. And widening the lens is really about thinking about diversity to include other things. I'm going to point out a couple of things that are in this frequently missed: geographic area and ideology. And some of you might say, what does that have to do with wellness? If we just look at the issue of masks being worn to protect against COVID, whether or not someone looks at that as a preventive measure can be tied to the geographic area they live in, and it can also be tied to their political ideology. And that's just an example that is very heavily in the news right now, that we know that we are having a debate about whether or not to wear a mask, when we have health officials that say this is a preventive measure. So when you start to think about your wellness programs and how you're designing these programs and what you're offering and how you're reaching people, you have to begin to think beyond the race, the ethnicity, the gender, and really think about other things that can define a person's culture and can influence how they make wellness decisions and how they participate in wellness services. And it's also about looking at the intersectionality of individuals. So if you're looking at your inclusion and your goal is that we are going to reach communities of color, and your efforts are targeted towards communities of color, those communities of color, the individuals, they will fall into various categories. So your communities of color are going to have different genders. They're going to have different religions. They might even speak different languages. Some of them might not identify with a particular gender. So their individuals are complex, and being able to understand the intersectionality of an individual is important. And that comes through having conversations, being able to engage in surveys, to be able to know exactly who your workforce is, who your audience is, who your target population is, and the complexities of that individual. This takes us to the topic in a little bit more detail, and that is our wellness initiatives. I want to talk a little bit about provider network adequacy. And I'm going to tell a story of an acquaintance of mine. And I don't even think she knew that I had, that I was in the healthcare space. She was just sharing a story with me. She was an African-American female, Muslim, going through a divorce, and she had 2 teenage sons. her sons were having a very difficult time with the divorce. So she was looking for counseling. Now, sometimes those services are offered through the health plan. Sometimes they're offered through an employee assistance program, which frequently comes underneath your wellness initiatives. Sometimes your wellness program is a part of your health plan. But she was looking for a provider, and she had three choices. The choices were three white males, which she assumed, and probably correctly so, that they were of a different faith. The question she said to me was that she only had three choices. She didn't feel like any of those providers would be able to relate to her teenage sons, nor did she believe that they would have the Islamic competency to be able to provide her counseling as she was going through a divorce. And what I said to her was, you probably need to get a provider out of network. And she said, they won't pay for a provider out of network. I said, then go back and tell them that they have failed to provide an adequate provider network because they have a network that is not multiculturally competent. And she looked at me and was wondering if that would work. About 2 weeks later, I got a text message from her, and she just said, thank you. My family's in counseling. So this is just one example, and where who your providers are can influence whether or not your employees will take advantage of your benefits. So how many of you who have wellness programs have actually looked at the makeup of your providers and whether those providers reflect your employee population? And if it does not, is that a barrier? Is that a barrier to them receiving services? And this brings me to the next issue, and that issue is access to care. And you see, the prior story that I told you, that was a situation where a lack of inclusiveness was preventing that person from getting access to care. It was only by coincidence that she happened to talk to me, and I knew enough about healthcare to tell her how to go back and ask for services outside of network. I'm going to tell another story around that was very impactful for me around access to care. I had a client as a consultant working on a compliance matter for a healthcare company, health plan. And there are low-income individuals, their copay gets waived. There's a program where their copay for pharmaceuticals got waived. And I was in a meeting, and I was the only person of African descent around a table of probably about 15 department heads. And the issue came up that there was a glitch in the system in the evening where members who should not have been charged a copay was being asked to pay a $2 copay at the pharmacy. And no one at the table thought this was a major problem. And I said, oh, that has to be fixed immediately. And they said, well, they can come back the next day because once it denies, we then approve it, and then they can come back the next day and get their prescription. And I said, that's an access to care issue. And they said, how is that an access to care issue? It's only $2. And my response was, the only reason why you're saying it's just $2 is because you have $2. There was not an understanding that there's a population out there where $2 can be an access to care issue. Then the response was, well, they could just come back the next day. Well, what if they used the last bus pass to go to the pharmacy that evening and they don't have a means to get back to the pharmacy the next day, or the next day they have to be at work that they cannot miss? So this really hit me that, wow, this lack of awareness about how other people live was creating an access to care issue. We had about 15 executives around the table who did not see this as an access to care issue. And this is also important about who's at the table, because not having someone at the table that was sensitive to the fact that this is an issue could have been a big problem. And the reason why I'm focusing in on this access to care issue, because in the regulatory world, the access to care issues are usually bigger fines. They're bigger violations when you stop someone from getting access to their care. And you think about in the wellness space, are there services that people are not getting because the initiatives are not inclusive? Are there screenings that people may not get because of a lack of multicultural competency in being able to reach those populations? The next area that I had promised to talk about in the description was social determinants of health. And here I actually found this graphic and some of the stock art. And I looked at this and I thought it looked pretty comprehensive. I mean, there's a lot of other things that can also be in the category of social determinants of health. But these are just some of the things that can impact a person's health. I was reading a study around asking, taking surveys of patients on whether or not they were having issues with their utilities, not being able to pay their utilities because there's stress associated with that, which they refer to as utility stress. And what they found is that they probably had underestimated how many people were experiencing utility stress by, they had only tapped into about 17% of those that were really experiencing it. Why? Because they took the survey during the wrong time of year. So for instance, if you're taking that survey when the weather is mild, they may not be underneath utility stress. Winter come, heating bills go up, now you have an issue of utility stress. And if most of you are in the wellness space, you probably understand the connection between stress and health. There was a study that was done of this particular study was done with a program that WellCare did, where they address social determinants of health. And what they found was that their cost fell by 11% when the health plan addressed social determinants of health. WellCare's program was called Health Connections. And what they did was they provided free referrals to a nationwide network of local community-based public assistance programs. Humana also have a program called Bold Goal, and their goal is to address key social determinants of health, such as food insecurity, loneliness, social isolation. Blue Cross Blue Shield has a program called the Blue Cross Blue Shield Institute. And that's an organization dedicated to maintaining the social factors that can impede a patient's access to healthcare. There's a link here. If anyone is interested in the study, there's a link that you can look at. And I'm trying to look in the chat and see whether or not there's anything in the chat, but there's a link that you can look at to talk about that study and to think about, like, are there ways that you can incorporate addressing social determinants of health in your wellness programs? And I want to give you an example, one that we talk about in our in the multicultural competency. And I'm referring to the Multicultural Competency Certificate Program, High Level Wellness. And I use the term R because I was one of the SMEDs, the subject matter experts for that program, but it is actually the National Wellness Institute and HR.com's joint project. But one of the examples that we talk about is smoking cessation. And a lot of wellness programs, they focus on addressing smoking among their employees. And not recognizing that there are social economic factors which may require for you to put a different type of focus or more resources to addressing certain populations. There is a correlation between education levels, income levels, and neighborhoods on smoking rates and the success of quitting smoking. And I'll give an example of something that could fall in the category of a social determinant. Oftentimes, communities of color are targeted more in advertisement around smoking. So it's on the billboards, it's in the community. There's a lot of money that's pumped into the community in order to promote smoking. This does have an impact on how successful your smoking cessation program is. So think about ways that social determinants of health could impact some of your offerings for your employee wellness programs. I saw here in the chat that someone said, how do we gather data to determine the social determinants of health that most affect our employees? One is, you can do surveys. Obviously, surveys is one way to be able to get data from individuals in terms of where they are, what social determinants might be an issue for them. But first, it's about understanding what social determinants of health are. And we have a slide, so you have the presentation, which to begin to identify what some of those issues are and to be able to ask some of those questions. It's also through the conversations, whether or not it's focus groups, to be able to have some conversations. If you have one-on-one coaching, some wellness program actually have wellness coaching, and our the Multicultural Competency Certificate program actually goes through ways in terms of being able to engage in questions and to be able to engage in conversations with diverse populations to be able to identify where some of those issues are. And look and see if we have any other questions. That's a question that was just answered. If you have any other, if you have questions that you want to put in the question box, please do. I see another question here, which someone asked, what is the difference, but said that I used the term health inequities and health disparities, and what's the difference between health inequities and health disparities? Those questions, those two terms are used a lot of times interchangeably, but they are different. Health disparities refers to the differences in health status. Oftentimes it's used to refer to negative differences, but health disparities addresses differences in health status among different populations. Health inequities refers to more unfair health conditions and injustices around healthcare. Okay. All right. If you have any other questions, you can, I'm going to go through a couple more slides. You can put those questions in the chat or the question box. Let me take you through a few resources. Okay. So the one resource here is the National Wellness Institute's Multicultural Wellness Wheel. And there's a link here for you. You can go to the National Wellness Institute's website. And on the website, there is a video. In the video, I think it's about a 3-minute video. The video will kind of walk you through how to use this wheel. But you'll see on the outer ring of the wheel that there are different demographic information, different things to show diversity: socioeconomics, education, gender, age, ethnicity, sexual orientation, religion and spirituality, and race. This is meant to get you to start thinking about widening your lens around diversity. But yes, you can go to the National Wellness Institute's website, look at the video and learn a little bit more about the wheel. I believe the wheel was included as a handout. If not, you can certainly download it when you go to the link. Here's a few more links for you. There's a couple of tools. I also mentioned in the description that there would be some tools that you could walk away with from this presentation. And these are 2 tools that are a part of the certificate program. And you can download both of these tools at no cost. And the link is there. One is the Organizational Multicultural Competency Wellness Inventory. And that is a tool that is designed, it's a pretty comprehensive tool to allow you to be able to take an inventory of where you are from a multicultural competency standpoint with your wellness initiatives. I would highly recommend that you take a look at that tool. It not only looks at just the wellness program itself, but also the organization. wellness programs that sit in an organization that is not well tend to be less effective. So that's one pretty comprehensive tool. The other tool is a multicultural competency self-reflection tool. And this is a great tool for you to be able to do some self-reflection, which is also key. Sometimes doing this self-work can be very uncomfortable. And it certainly can be uncomfortable when you're doing it in a setting with others. This is a self-reflection worksheet that you can use on your own, that you don't have to share with anybody, but it's a good tool for you to begin to start doing a little bit of that self-work. And the last tool is an article that I wrote for Benefits Magazine, and it's creating a multiculturally competent worksite wellness program, the why and the how. Okay, and I am going to look and see if we have some questions here. One question is that I've used the term multicultural competency. Is that different from DEI? And the short answer to that is yes, it is different from DEI. And I look at multicultural competency as more comprehensive. It does include diversity, equity, and inclusion, but for years when people talked about diversity, equity, and inclusion, in fact, equity is kind of a new addition, but there was a lot of emphasis on diversity, and diversity really looks at the differences between people. Whereas the multicultural competency is a focus on being able to see differences in individuals without assigning any kind of value. So it's difference in you and individuals, it's difference between individuals. It really looks at even things like not just things around race and ethnicity, but really looking at differences in worldviews, differences in values. And it also is developing a competency around communicating with a cross section of people, and not really the kind of, this is how you deal with African Americans, or this is how you deal with Latinos, or these are the issues that are present in the LGBTQ plus community. But it's really about being able to do the work at an individual level. The next question. Where are some key points that the wellness department can share with DEI leadership that help to create a more collaborative relationship and not functioning as two separate entities? That's a very good question. And I think we are seeing that because there's a lot more focus now on diversity, equity, and inclusion. I believe it's being recognized a little bit more by the leadership and by other departments. But one of the things when I'm working with clients, one of the things that I encourage is that they are making sure that they hire DEI professionals at the right level. And what I mean by that is that I mean hiring individuals that will be able to participate in some of the leadership meetings, and to be able to collaborate with those different units. And I think we're starting to see that DEI is now falling underneath different departments. Historically, it's been a part of HR, and a lot of that emphasis has been around hiring. I believe that the DEI efforts now are actually crossing more over into the employee experience, is crossing over into community experiences, is crossing over to hiring of vendors and subcontractors. So the answer to that question is engaging in the conversations around DEI at the right level and being a part of those meetings. It's also forming committees, and that may be a DEI committee, it may be the Multicultural Competency Committee, but it's actually forming committees where you get those opportunities to be able to work across units and across departments. I see a question here, and I'm not sure of, trying to understand the question. So it's Healthy People 2030 uses leading health indicators to promote the health of the nation. Where does SDH fall? So I think that came from Anita. Maybe you can give a little bit more detail in terms of that question. Okay. Any other questions? All right, I've been talking a lot about this. I've been talking a lot about this high-level wellness through multicultural competency certificate program. And I just want to put my disclosures in before I talk about this. One is I'm the immediate past president for the board of directors for the National Wellness Institute. And I currently sit on the advisory board for HR.com's Diversity, Equity, and Inclusion. So I do have a connection to both of the organizations that offer this program, but I don't get any financial benefit from the program. And I've been a subject matter expert for it, and I've gotten a lot of feedback from individuals that have gone through the course. And it's a course that I think could add a lot of value for anyone who's interested in increasing their knowledge around multicultural competency. It is a 12-week self-paced course. And for those that are attending the webinar today, there is a promotion code, the NWI 105, and that actually allows for an NWI discount of the rate is normally $1,200, but the discount is $695 in case anyone is interested. Okay. And I am strolling, trying to see if there's any other questions in the chat. Okay. And okay. If to reach me, here's my contact detail, my website, my email, LinkedIn. Definitely reach out to me if we're not already connected on LinkedIn. Shoot me a LinkedIn connection and let me know that you were in attendance for this webinar. And you also have my Twitter.